Anytime you go to the acupuncturist and he puts needles in your back to cure a headache or to help you with an injured shoulder, that's Eastern medicine.
Well, welcome everybody to the D4A Personal Injury Show. Here, Jean-Paul, and with my co-host, Nicole.
Hi, guys.
Today, we will be interviewing Dr. J.P. Khreich.
You got it.
Yes, we did it.
So listen how lucky I am. I get to sit here today with two JPs. How cool is this?
Yeah, you know.
Super cool.
It's like,
thank you for having me.
Absolutely. Absolutely. Welcome. Go ahead, Nicole. You were going to start with
I
the
wanted
first one?
to elaborate on you do sports therapy. So let me and you work with competitive athletes. What is the difference between working with a competitive athlete and working with someone who has been involved in a car accident?
So you would think it would be different, but we actually take the same exact treatment philosophy and treat both patients with the same protocol. Usually our protocol is based on 3 phases. The first phase is the passive phase. When you're injured and it's an acute injury, everything we do is passive. You lay down and we may do ultrasound, electrical stimulation, laser therapy, heat, ice, rest, compression. And then we move on to the subacute phase where we are stretching you, or we're doing acupuncture, or we're doing cupping, or we're doing some movement patterns to start getting that joint to move and to start getting it to recover. Okay. And then the third phase is the active phase. Now we're teaching you how to exercise these injured muscles. We're trying to bring life back to these muscles. We're trying to get them to become as strong as they were before the accident or before your sports injury. So really the treatment is the same. You just have to know your patient, and you have to know to what extent you can do things that you want to do to their body, and they will both recover at the same rate.
My question is, between those 3 stages, what's the main stage that you identify a more severe injury that needs to be referred out to either pain management or ortho?
That should happen right away.
Right away.
That is in the
so
acute
within
stage.
the first stage with doing the little bits of
first
therapy.
2 weeks, we typically can tell you whether you're an athlete that you need to go get an MRI because we're suspecting a disc bulge or herniation. Okay. Or an X-ray because we may suspect a fracture. Okay. Or we may call your attorney and say, hey, your patient now needs an MRI. We're suspecting a torn rotator cuff. And after the MRI, depending on what the outcome is, then we may send you to the orthopedic surgeon or to someone else that may tag team this patient with us.
Got it. So this is where we want to debunk it. It's very vital to see chiropractic, to have them completely evaluate you, because you're not only evaluating, you're not like an ortho where it's just bones, or a physical therapy where it's, just muscles and tendons. Explain what chiropractors do all around for the body and how you can evaluate someone that's been injured.
That's a great question, Nicole, because a lot of people come in and the first thing they ask me, why am I here? Why am I at a chiropractor? I was in a car accident and my back hurts. Why am I not in physical therapy or seeing an orthopedic surgeon? And I always tell them that a chiropractor is a doctor. He is a guy that can evaluate and determine the treatment plan for both muscle injury and bone injury. So he's the guy that can determine if your shoulder muscles are torn and they need to go to the surgical route, or if they're just sprained, strain, and we can give them rehab. We can give them physical therapy, because a chiropractor is trained to do physical rehab and is trained to do recovery treatments and neuromuscular re-education. But at the same time, he's trained to adjust the spine, align your back, bring some hip mobilization, or work on your wrist. So instead of having to go to all these providers to see for every body part what's going on with you, a chiropractor, or I should say a good chiropractor, should be able to...
I hear some sales going on here.
Should be able to evaluate you and decide on the protocol that we should take.
Wow.
That's awesome.
And let me ask you this. So what happens when, you get rear-ended by somebody, you have I believe whiplash, right? Whiplash injury. Most people do at least, right? Your neck goes forward or back. What is usually I guess, what would you call it? The whiplash.
The mechanism of injury.
Mechanism. Yes, there you go.
So
I think it depends on the angle that the car was hit, though.
Sure. Now, a whiplash in a textbook sense is when someone rear ends you exactly from behind, and the seatbelt locks, but your head doesn't stop. So your head goes forward, and then goes back, and it hits the headrest, and then it goes forward again. So that motion is not only injuring your neck, it's injuring your upper back, and now we're finding out that it's injuring your jaw and your TMJ. Wow. And a lot of times it injures your brain. And that's why now TBI has become very popular, because now we are looking at it and we're evaluating it more. You don't have to hit your head to have brain injury. Your brain is suspended inside your head in water. And just by shaking your head really fast, your brain sometimes shakes inside your skull and hits the sides of your head. And it causes trauma. A whiplash injury is very important to be diagnosed correctly, because there's a lot of different steps and a lot of different levels of injury that comes out of it.
And that's really scary. I mean, TBI it sounds really scary to have a type of brain injury. How does a patient identify if they have a TBI after a rear end accident?
Or how would you identify it?
Exactly. I mean, obviously, TBI definitely needs to go to a neurologist or someone that specializes in that area. But as a chiropractor, which is the gate of entry physician, the first guy that you see has to identify it by either a questionnaire that we give the patient, part of the questionnaires that we give them to fill out, by the history. That's why you have to listen to your patient. When a patient is telling you, I'm misplacing my keys, I'm having headaches all the time, I'm forgetting passcodes to my locker room at the gym, I'm having a problem going to sleep and staying asleep. These are all little feedback answers from the patient that should trigger what to do next. And this is where a good doctor comes in.
So I wanted to talk to you about TMJ. This is big. This is coming up in the industry. God, tell me how TMJ happens. First of all, what does it stand for, and how does TMJ happen?
Sure. So TMJ is really the name of the joint that gets injured, the temporomandibular joint. And it's really the jaw joint. So when you open and you close your mouth, that's the TMJ getting opened and closed. But when there's an injury to it, we also call it TMJ. A TMJ can give you clicking, pain, stiffness, soreness, which can lead into headaches, inability to eat, to chew, and eventually inability to breathe when you're sleeping. You may develop even some sleep apnea due to that issue.
Oh, wow.
Usually we talk about TMJ from other aspects other than car accidents, like someone that chews a lot of gum, or someone that eats a lot of hard food like apples. But nowadays we're seeing that TMJ is coming out of whiplash injuries. Your head hits the steering wheel. Maybe your airbag didn't deploy. Or even when your airbag deploys and it's so hard and so fast coming at you and it hits your nose, your jaw goes back and it gets dislocated, or it gets subluxated, or sometimes has a little fracture in it.
Jeez.
Yeah, airbags are definitely not like pillows. They're pretty...
That's for sure.
They're pretty firm.
And a lot of times what people don't realize is that there's a disc in this joint, just like the disc in your neck. And it can bulge and herniate just like the disc in your neck.
Wow. Jeez. So how would you adjust a jaw? That's my question.
Okay.
Good question. Yeah.
First,
here, let's get on camera. We'll
first
do it.
and foremost, we need to get a CAT scan of the jaw.
Okay.
And if the CAT scan shows us some irregularities or things that are not looking normal, then we can even order an MRI of the face and get the jaw on an MRI as well.
Okay.
And see to what extent are your injuries. If they're minor, and they can be corrected manually, that's where I come in. We have different tools that we use, all by hand. One of them is called fast and functional neuromyofacial therapy.
Okay.
We can also use cranial sacral therapy, cranial facial therapy, chirodontics. These are all classes and studies that teach chiropractors how to treat the jaw. Put on some gloves, I put my hand in your mouth, we do some massaging, we do some stretches, we teach the patient some exercises to do, and that's our myofunctional therapist. And if that corrects the issue, then you're great. But then if it doesn't, in our center we have a dentist, an orthodontist, an oral surgeon, and they come in and they do different procedures. Sometimes they use a homeoblock. It's a little device that they put in your mouth, and they tighten it to try to either enlarge or change the shape of your mouth from inside out.
Wow.
Wow. Does that make your jaw bigger or wider by any chance?
Yeah, they're called
really?
expanders. So I've seen patients that are in the expansion process, and you can see their teeth widening to gap in between their teeth because their jaw is moving out.
Expanding out, wow.
And then you use braces to bring the teeth back.
Right.
Then our sleep study doctor will do a sleep study on the patient and see if their jaw and whiplash injury have caused them to develop maybe sleep apnea or develop problems while sleeping, which is breathing issues.
Right. Yeah, I was just reading an article about that.
I think you get prescribed CPAP machines for breathing.
Well, that's if there's no fix to your problem. But now we're trying to take patients out of a CPAP machine or the new one where they install in your heart to help you breathe at night.
Wow.
You hear it on the news. We're trying to fix them the natural way by putting a block or a homeoblock in their mouth and getting their brain to give messages to your jaw to open up, and your tongue open up and lifts up and helps you breathe at night without having to have procedures done.
So, in your experience, how important is it for an individual recovering from a personal injury to focus on both Eastern and Western treatment philosophies? And how does this approach complement each other?
It's a great question.
I kind of want to add to that a little bit. So there's Eastern and Western medicine. Explain to us, too, with phobias. Some people have phobias with certain treatments.
Sure. You know, Eastern medicine to the average person is anything that doesn't involve drugs. Anything that you get treated with that doesn't involve you taking medicine or taking a shot or having surgery. Eastern medicine focuses on treating the body as a whole and treating the body with your hands. So anytime you go to a chiropractor and he adjusts your back, that's a form of Eastern medicine. Anytime you go to the acupuncturist and he puts needles in your back to cure a headache or to help you with an injured shoulder, that's Eastern medicine. Western medicine is whenever you see your medical doctor for some ibuprofen or for some meloxicam or for some Vicodin for your pain. Or if you go to the pain management doctor and he gives you an epidural shot or a PRP injection. I think the two are as important, but there's a time and a place for each treatment. When a patient comes in on their first day, you're not going to send them somewhere to get a shot. But if a patient is on the street after a car accident and he can't move and he's screaming bloody murder, a lot of times they have to give him a pain shot to calm him down.
Correct.
And to get the pain to relax and ease up so this patient can be transported to the hospital. At first, we try all that we have in our bag of tools to help you without the use of medicine. We're stretching you, we're massaging you, we're adjusting you. We give you a little exercise to do to hopefully get this blood flowing and get your body to heal itself. But you know, when an MRI comes back, and there's a full thickness there of your rotator cuff, now you need to get the Western medicine. You need to be sent to the orthopedic surgeon. You need to determine whether a PRP injection, plasma-rich platelets, is good to be injected in there to help your body repair itself, or if you need to go to surgery. I do have a lot of patients that say, you know what, don't ever send me to the orthopedic surgeon. I'm a holistic person, and I'm going to try to fix everything that I have with what you got, doc. And I tell them, look, I'm not sending you away, but that 8 mm disc herniation in your low back is not something that I can fix or repair. I may give you temporary pain relief, but sooner or later, you're going to have surgery. So you know what? Do it when you're young and when you're healthy and when your body is equipped with the right tools to speed up the healing process.
The recovery.
The recovery. So that's why we offer both at Fitness Chiropractic. We have your chiropractor, we have your acupuncturist, you're doing physical rehab with the massage therapist, you're getting massage, and we also have an orthopedic surgeon that comes in on staff to evaluate our patients, or the pain management doctor that we have. We can refer you to, or he can come in to see you.
So lastly, looking ahead of the future of chiropractic care, what excites you the most about potential for growth, innovation, and further enriching of lives of individuals?
I think collaboration is my biggest thing that I'm looking forward to. When a chiropractor is collaborating with the orthopedic surgeon, when he's collaborating with the neurosurgeon, when he's collaborating with the orthodontist or the dentist. Okay. I think when you take an approach as an individual and you try to do everything on your own, you're bound to fail. But when you bring in other professionals with you and you collaborate and you talk about the patient and you call each other or email each other and you show them what kind of findings that you found in your office and share it with the other person that's treating the patient, then you have that team approach.
Got it.
And that's how I try to structure our clinics, and that's why I teamed up with the dentist and the orthodontist, because I want to bring in a new aspect to the personal injury world that's not present at this moment.
Again, last question. It's called Fitness Chiropractic and Massage Therapy. And where are you located? How many locations do you have? Let's get down to that. Let's go into detail now at this point.
Oh, yeah. The good question. You leave it till the end.
The final good question. Where can people find you?
Fitness Chiropractic is located in Huntington Beach,
okay,
at a big shopping center called Bella Terra. It's also located in downtown Long Beach, across the street from the new courthouse.
Okay.
And we're also, our Aviera office, which we teamed up with Aviera, the dental office, we are in Los Alamitos. So Fitness Chiropractic and Aviera are in, under one roof in Los Alamitos. All 3 locations are equipped to treat personal injury patients, patients that were injured on the job, athletic patients that were injured doing what they love to do, and just your average person that sits at a desk for 10 hours a day and goes home and wonders, why do I have back pain? Why does my neck bother me? You can find us at fitnesschiropractic.net. We're also on Instagram, Facebook, YouTube, even TikTok. And we look forward to seeing you and helping you get better.
Awesome. Thank you again, Dr. J.P. Khreich. This is J.P. Khreich with Fitness Chiropractic. Thank you for coming on to our show as I'm stuttering. Don't forget to like, share, and subscribe on our channel.